my dear friends. Today we are going to ask Dr. Sridevi, when a woman have a regular period, the period has not come for about a week. It's been postponed for about a week. Because these kind of questions, a lot of patients they ask, sir, our period has been extended, is not come for about a week or 10 days. So what are the things we are supposed to do? That's a question. So I am putting the same question to Dr. Sridevi. Can you please explain, doctor?
Yeah, thank you. So first, if you have a missed period, that is every month the period occurs, maybe around 28 to 32 days, and you have missed the periods, that's it's more than 35 to 40 days. So then what do you do is, first you think whether you are pregnant. So to confirm if you're pregnant, we first take a urine pregnancy test. So when you check, that is you check your urine and see whether you're pregnant or not. Now it comes as pregnancy, that is you're pregnant. Then what else you have to do is, first confirm, go to a doctor, and then what they do in the hospital is, they will after checking your pregnancy, they will give you a series of basic blood tests to be done. Why we do the blood test is whether we have any abnormality and any medication has to be started, or so that's the reason we do a blood test. And also if any medication has then when you visit the doctor, you have to give your previous history of any medications taken or any surgeries. So accordingly, whether the medication the dose has to be increased, or whether it can be maintained, or you have to stop certain medications. Because now it's not only you, it's also about a fetus growing inside you. So whether it passes through to the baby. Then you also, they will give you folic acid, which has to be taken. Some people started before, when even they plan for pregnancy, and some people may start after confirmation of pregnancy. So after confirmation of pregnancy, no other medication should be taken. So even for a common cold or any sickness, it has to be only with a consultation of a doctor. And what else should not be done is, any places where they take X-ray, that is any radiations, for example CT or MRI or X-ray, should not be done because they can cause some problems, so it should not be done. And no other medication should be taken. So over to Dr. Viswanathan.
Yeah, see, now we were discussing what after the periods has not come, is extended for 1 week or 10 days not come. As told by Dr. Sridevi, whether the patient is pregnant or not, sometimes delayed period even without pregnancy, then that has to be consulted in a different line. Why it is being delayed? Is it occasional or is it some reason? They call amenorrhea. Otherwise, if it is pregnant, whatever she said, that has to be followed. Other thing like to add up, if you are pregnant and don't do unnecessary any new activities, not too much exercise, or as she rightly said, no unnecessary medication. And other than that, probably a regular checkup. They plan the checkup for the patient when it's supposed to come. They confirm, they'll ask her to come for ultrasound later. All the basic fundamental basic tests will be taken. And I think, no undue activities. You may not be able to take the diet because of some nausea, vomiting, but even then soft diet can be taken. A lot of fluids can be taken. And what else? Anything we have missed when the patient comes? Anything else you want to add up? I think that's fine. Once they missed a period, you have to identify. Anything else? No. Okay, then thank you. You can consult your doctor for any further. This is just educational video. Anything missed, you can always consult your personal, the consultant doctor. Thank you.